Good morning, afternoon, and evening. My name is Andres Constantine, and I am the Assistant Director of Health Law Programs at the Unit Institute for National and Global Health Law at Georgetown University in Washington, D.C. Thank you for joining me today. In this short lecture, we will explore the crucial role of global regulations in the response to the COVID-19 pandemic. Health risks in the 21st century are beyond the control of any government in any country. The unprecedented movement of people, money, technology, and ideas around the world is changing the profile of health and disease. Although in previous decades, we witnessed substantial reductions in major global risk factors such as unsafe sanitation and malnutrition, new threats have emerged. Global health hazards today share four important features. First, health hazards are not bound by borders, ranging from infectious diseases to non-communicable diseases and injuries. Second, they have common underlying causes, such as dangerous pathogens, unhealthy behaviors, or unsafe environments. Third, they are exacerbated by inequities linked to the socio-economic determinants of health. And fourth, they require a coordinated, multi-sectoral global response. A crucial element to this response is a strategic use of the law at all levels, local, national, regional, and international, resting on a stronger cooperation between the legal and the health professions and communities. In an era of globalization, promoting public health and equity requires cooperation and coordination both within and among states. Law can be a powerful tool for advancing global health, yet it remains substantially underutilized and poorly understood. The law is a key determinant of health. By law, I mean the statutes, regulations, and rules that express public policy. It also includes the public institutions such as legislatures, governmental agencies, and courts, which are responsible for creating, implementing, and interpreting the law. Law exerts a powerful influence on health by structuring, perpetuating, and mediating the risk factors and underlying conditions known as the social determinants of health, namely education, food, housing, income, employment, sanitation, and healthcare. The impact of law is felt not only in individual decisions of courts or tribunals, but also in statutes and regulations that operate at the population level, for instance, with mandatory seatbelts laws or universal health coverage laws. As such, law can be a powerful tool for securing and advancing health, justice, and equity. It can be used to set and defend norms and standards of good health, to establish and strengthen resilient health systems, and to hold actors and institutions accountable. Today, I want to focus our attention on the role of law during public health emergencies. I will use the COVID-19 pandemic as a case study throughout my presentation. Global health law and regulations play a vital role in facilitating coordination and collaboration among nations during a pandemic. Effective international legal frameworks and institutions are essential for sharing information, expertise, and resources between countries. Such cooperation enables the rapid development and distribution of vaccines, medicines, and essential medical supplies, ensuring a more robust and coordinated global response. Global regulations are then critical for strengthening health systems worldwide. They help countries establish legal frameworks that enhance preparedness, response, and recovery capacities. Additionally, these regulations enable the adoption of public health measures such as testing, contact tracing, and quarantine protocols. By ensuring that legal frameworks are in place, countries can better manage new outbreaks or emerging outbreaks and protect their populations. In our quest to prepare for future pandemics, it is imperative that we delve deeper into the realm of legal systems necessary for responding to new infectious disease outbreaks. By examining the legal frameworks of different countries and regions, we gain invaluable insights into the strengths and weaknesses of various approaches. Such comparative study or global study enables us to identify best practices, learn from past mistakes, and adapt our legal systems to the evolving challenges posed by infectious diseases. The COVID-19 pandemic revealed the profound impact of legal systems and the law on public health outcomes. We have seen how variations in legal frameworks, such as the authority of public health agencies, the balance between individual liberties and collective welfare, and the mechanisms for international collaboration can significantly shape the effectiveness and efficiency of response measures. By studying and understanding these variations, we can identify legal innovations and strategies that have proven successful in different contexts. And this knowledge can then inform the development of robust legal systems that are adaptable, evidence-based, and responsive to future pandemics. Access to healthcare, for instance, is a fundamental aspect of pandemic response. Global regulations play a significant role in ensuring equitable access to healthcare services and essential medical supplies. Legal frameworks that promote affordable and non-discriminatory access to vaccines, treatments, and diagnostic tools are then very, very important in terms of pandemic preparedness and response. These regulations aim to protect vulnerable populations and address health disparities that may arise during a crisis. Additionally, laws and global regulations are crucial in protecting human rights during a pandemic. Emergency measures and restrictions imposed to contain the virus should be proportionate, temporary, and respectful of human rights. International legal frameworks provide guidance and accountability mechanisms to ensure that emergency measures do not infringe on civil liberties, human rights, or the rule of law. Building resilience is key as well to effectively responding to future health crises. The role of global regulations in strengthening national legal frameworks and institutions to enhance legal systems, health systems' resilience cannot be overstated. It is important for governments to invest in legal preparedness, including legislation, regulatory frameworks, and interagency coordination mechanisms. By doing so, countries can be better equipped to respond swiftly and effectively to future pandemics. In year 2020 through 2022, we lived through the COVID-19 pandemic, which also exposed gaps and limitations in the existing global health regulations. These regulations primarily focus on the management of infectious diseases and fail to adequately address other critical aspects of global health, such as non-communicable diseases, mental health, and health inequities. Therefore, there's a pressing need nowadays to broaden the scope of global health regulations to encompass a wider range of health challenges. The pandemic also revealed the consequences of inadequate preparedness and response capacities. Global health regulations should mandate countries to develop robust surveillance systems, diagnostic capabilities, and public health infrastructure. By establishing clear guidelines and accountability mechanisms, these regulations can ensure that countries are better prepared to respond to future health crises and minimize the impact on public health and economies. Global health regulations should encourage countries to share data, research findings, and best practices transparently and in real time. This will facilitate the development of evidence-based policies, support research and innovation, and enable a more coordinated global response to health emergencies. One important thing that was magnified during the COVID-19 pandemic were the existing health disparities, with disadvantaged communities being disproportionately affected by this virus. Global health regulations should promote equity in access to healthcare, address social determinants of health, and prioritize the needs of marginalized populations. By integrating equity as a guiding principle, these regulations can help bridge the gap between developed and developing countries, ensuring that no one is left behind in the response to global health emergencies. The COVID-19 pandemic also revealed the fractured and inadequate state of global health law and governance infrastructure, and its deeply embedded inequalities. The most important infectious disease preparedness and response instrument, the international health regulations, has not reliably galvanized governments to collect crucial information on emerging disease threats or share data. Although the IHR, the International Health Regulations, requires state parties to establish and maintain core health system capacities, the regulations do not provide incentives for investment in national capacities to prepare for and to respond to infectious disease threats. Importantly, the IHR does not govern fair and equitable access to medical innovations and countermeasures, including life-saving medicines, vaccines, or medical supplies. Overall, the pandemic revealed gaping inequalities, whereby key medical resources developed in one area of the world do not accrue to the benefit of all peoples. Vaccine inequities, for instance, represented a major moral failure, but also a failure of the global governance system. So, recognizing the marked limitations of global health law in the COVID or during the COVID-19 pandemic, a rising number of states or governments have been supporting the development of a new pandemic treaty. This prospective treaty has the potential to clarify state obligations for pandemic preparedness and response and strengthen the World Health Organization authority to promote global health security. An innovative pandemic treaty could become a transformative model of global solidarity in the face of common threats, but it will also require states to overcome nationalist forces to meet this global moment with leaders that are embracing diplomacy across nations to prepare for new challenges. While a new treaty is greatly welcomed, negotiating or renegotiating the terms of a treaty typically takes many years or decades, and enforcing a binding international agreements is always challenging under any circumstances according to international law. The tension between the rights of sovereign states and the need for effective coordination in addressing a truly global threat is inherent in international law, including public health efforts to combat infectious diseases that cross national borders. So as I mentioned, law is a powerful tool that can assist us on this journey. It provides a framework for coordinating national and international responses, establishing legal rights and obligations, and ensuring accountability and transparency. Through well-crafted legislation, regulations, and policies, we can enhance surveillance and early detection systems, bolster public health infrastructure, facilitate the rapid development and distribution of vaccines and therapeutics, and protect the rights and well-being of individuals and communities. Furthermore, the law can foster international cooperation, enabling effective coordination and resource sharing between nations. Global health regulations facilitate coordination and collaboration, strengthen health systems, ensure access to healthcare, protect human rights, and enhance overall health systems resilience. As we navigate this global crisis and future global crises, it becomes increasingly clear that an effective response relies on a robust legal framework that transcends borders and promotes international cooperation. Future health crises are likely to arise more frequently and with greater severity, with considerable evidence that we are now living in an age of pandemics.